We're speaking with Dr. Dunlop of Coshocton Dentistry, and we just did a video on root canals, Dr. Dunlop, and you had some good insight about not having to be worried about that because modern dentistry takes care of it. Now we're talking about getting a dental implant, and the question is, will my gums grow around this dental implant?
Yeah, that's a good question. I mean, I think it kind of begs the idea that we got to have bone to do the implant itself anyway. And if you have adequate bone, the soft tissue, the gums, follow that. Okay. So, one of the considerations is that if you lose teeth, you do lose a fair amount of bone. And that's one advantage of an implant is it does keep bone for you in the long term.
Okay.
But for the short term, especially in aesthetic zones in the front of the mouth, dental implants are a little challenging. At times we have to engineer bone and tissue to make an aesthetic look. Because like I said, when you lose your teeth or lose a tooth, you lose bone, and it does create a deficit, a defect in that area. So most of the time though, with today's grafting techniques that are very simple, we can build bone back to the level where it was and create a very natural looking look. And, I think for most people, that's what we're looking to try and achieve is something that looks natural and like they haven't lost a tooth.
Yeah, and that's obviously that's a goal of anybody, just look like they always did. And but it's good to get this information because us out here who aren't dentists, we don't know how these things work. So once again appreciate getting your input on that, Dr. Dunlop, and always appreciate you guys watching. If you're not already there, head to the website CoshoctonDentistry.com.
Yep. Thank you, Randy.